We're going to introduce next Team Hope. It's represented by Brenda Liddell.
Yes.
Who grew up in Ward 8 and lives in 7, has lived here for 16 years. She's a patient advocate and business owner working to help people better navigate the healthcare system. Brenda's also a parent educator serving families east of the river. Welcome, Team Hope.
Thank you. Hello, everyone. Thank you for being here with me tonight, with us tonight. I'm not going to take long here. So you see the logo there, Extended Hands Advocacy. That's the company that I started some years ago due to the fact that my grandmother was misdiagnosed. And by the time we found out as a family what was going on with my grandmother, it was too late. She was diagnosed with liver cancer. So with that being said, I said that I was going to be the voice to help people such as my grandmother help navigate the healthcare system. Okay, so the problem that we saw with Team Hope was residents of Ward 7 and 8, they aren't clear on how to access care services available to them. Residents are reluctant to do so because of their past experiences. So with okay, so we talk about all of these wonderful tools that we have, and that was our first prototype. It was a tool called Pathway to Health, and it had all of this wealth of information. Tamika touched on how with Team Bloom touched on the information that's given out to folks. You know, they pick it up, and that's great, and people read it. However, if they don't understand what they're reading, and especially the advocacy part, so I'm gonna expound on my piece of what I want to bring to the community and be that heartbeat for all of this wealth of information, right, that's out here. So the lack of information, poor service, customer service was the first, when speaking with residents, customer service was the first concern that the residents had. So I said, okay, let's talk about customer service. How can we make it better? Building relationships and face-to-face. So being a patient advocate, we cover all three areas, right? So you're a patient or a family member, you don't know what's going on. You want to know what's going on. You don't know what to do. You don't know what questions to ask. Here comes the patient advocate to hone in on what those concerns are. We're trained to be able to unpeel the layers, should I say, with your healthcare and help you navigate the healthcare system. So who we talk to the residents, of course, community leaders, physicians, nurses, administrators, managers, and the front office staff. Because most of the times, I know for myself, if I walk into a hospital setting, a doctor's appointment, I'm already up here. I'm anxious, I'm overwhelmed, and I can't tell you how many people that I have helped serve that may have gone into a healthcare setting just to have a lab test done, to be told that they may have a disease, they have to come back, they may have to stay in the hospital. So the patient advocate will be able to, again, help navigate their concerns, should I say, because they come in. Can you go back to the next page? Because I want to go back to customer service really quick. So we start off with the front office staff. So if a patient is coming into the hospital or a hospital setting, and the front office staff, they're not in a good space, maybe there's something going on with them. By the time they get to the nurse, they're complaining about what went on with the front office staff. And then by the time they get to the physician, they have forgotten about why they're there because they're mad about the front office staff. So a patient advocate would be able to go to Well, my style is I would go directly to the source and ask what's going on. But our main purpose is to get that patient what he or she needs, the care. So now we can move forward. So that's the customer service. And then, when you're building relationships and you're doing these face-to-face interactions with the team, and that was the team, the outcome is much better for the patient, the family, the physicians, the front desk office, because the patient advocate, again, is there to help things be better. Okay, so the patient advocacy service, I just spoke about it, all three here. We can go ahead to the next slide. So what we tested, we interviewed, A/B testing of health information formats, testing preference for healthcare advocate versus patient advocate, surveys to assess the need for a patient advocate. So real quick, with the interviews, we were able to go to the Safeway, CVS, and the library. So I spoke with people there, right? So again, remember when we pick up all of this wonderful information, I wanted to take it further, and I did a testing of the patient advocacy piece, right? So with the first prototype, it showed please contact a patient advocate, right? But it didn't say what the patient advocate did. So I just took another prototype and added a few bullets of what a patient advocate can do. So I simply asked the residents, which one would you take home with you? And they chose the one for the bullets with the advocacy piece, because people don't know what an advocate is. So I then asked, what do they, in testing, healthcare versus patient advocate, right? The residents identified with patient advocate, and you know why? Because of the word patient. It was real simple. The word patient, because everyone identified with, well, I've been a patient before. It's outpatient, inpatient, so people identified with patient advocate. And then I did a survey, simple survey, pretty much bullets. And I did meet and greets as well to explain what each area that I could cover. And it's more information in the back. When you come, you'll see what I'm talking about. Okay, so what we learned, I know that, and this is what people said, I know I could use these services, okay? There is a public interest, right? People prefer patient advocate. People want further information. I'm gonna tell you, I've been doing this since 2014, right? Pro bono, and I'm all right with that, right? People need patient advocates. They need patient advocates. People do not understand the healthcare system now. And because of all the technology, the healthcare system is moving. Soon we're going to be doing face-to-face on the telecom, on the screen. The patients will be able to talk to their physician on the computer. Now, I'm a hands-on, I want to feel your pulse, and I want to know what's going on. Now, technology is going to continue, right? So again, I want to keep my hands on the pulse of the human being, okay? So move on. So our next steps, I'm going to be doing more meet and greets so I can introduce what a patient advocate is, right? I'm going to do some surveys so people can understand. I had a really great session with the Southern Gardens community, and they actually invited me back. I also, and I didn't have it on the screen since then, I was able to speak with a couple of churches that have invited me back, and I want to now move forward because Sibley, you guys kind of pushed me out there, right? As far as saying, I'm really here openly because I was doing it one by one. It's only me, right? So I can do one by one, and that's okay. That's okay. I'm going to have one-on-one sessions with physicians, medical offices, hospitals, and urgent care facilities, because I know, because of my experience in healthcare, is that advocates actually are a part of preventive health services. Because if we, the advocates, can stop the in and out, why are you coming in and out of the emergency room? Why are we using the emergency room as your doctor's office, right? So my goal is to go and connect with these wonderful, again, medical centers, organizations, to see what can I do to help prevent the in and out, the unknowing. So call to action. Share information about patient advocates. That's the meet and greet. Partner to train and place more patient advocates on the ground. We need that. We need more patient advocates on the ground. And Team Hope commissioned as a third-party system to systems improvement services through relationship building. It's all about relationship building. It really is, because at the end of the day, each one of us, and Tamika touched on it, titles, whoever we think we are, who we've been, where we're going, at the end of it, guess what? And I've been a witness to it, because I was down myself with my health at one time. And we just keep moving. Everyone in this room is moving. We have a lot to do, right? And this is about health. But at the end of the day, we will have to sit down, right? So when we sit down, we want to be able to know how to navigate this healthcare system, because it's changing rapidly. And that's it. I thank you, Sibley. Thank you, each and every one of you, for this wonderful platform. This is an awesome platform. And the Advisory Council, thank you. That's it. Thank you.